Drake or Kendrick?
Kendrick.
Yeah.
I don't think it was like a rap beef for like who was the better rapper. And I think that like people mix that up in terms of the message, like acting hard or like acting like it was from the streets or like, you know, trying to pose and everything like that. The feeling that invoked in me of like, this is weird, because anybody who is in a better position wouldn't necessarily be promoting that. They would be trying to advocate for getting away from it if they actually knew what that lifestyle was like. And so I think that was the essence of the rap beef. You make good pop music and good dancing music, but like you're benefiting and like profiting off of like people's worst experiences in life when you haven't lived that lifestyle. And that's why I say like I side with Kendrick.
And he did it in a bop.
Yeah, exactly.
He talked about him in a bop. So
if you're over 50, go and get your colonoscopy. Females over 40 got to schedule that mammography. 50 and you know you got a 20-pack year history equipped with the 1.5, then you need a low dose chesty. So like kind of trying to give them like the screening and preventative measures so that they can get ahead of some of the things.
How long have you been doing this for?
I started like my freshman year of college, and I wrote like songs on photosynthesis and some of like the kind of like molecular information that we were learning, like chemistry and biochemistry. I've actually been able to actualize who like my target audience is. And I always say that when it comes to clinical raps, I'm making a rap to be understood by a young kid who's being raised by their grandparent. So that they can have the wherewithal to notice, like, you know, what things can they communicate to their grandparents that they should know? What things can they be talking to like aunts, uncles, parents, and things like that? But also like, how can you start that conversation so it's two different generations communicating about health?
Hey everyone, this is the real Theo Harvey once again talking to you about the new normal of healthcare with medical success secrets. And I'm super excited today that we have Dr. Terry Everett on the call. How are you today, sir?
I'm doing all right. I appreciate you having me.
Great. Hey, if you don't know, Dr. Terry Everett was born in Newport News, Virginia, and he attended college at VCU, decided to stick around for medical school. He is currently a fourth-year medical student at VCU School of Medicine, but his passion is educating the community, which sparked his presence online as Dr. Durag, where he turns medical information to songs that can be easily understood by patients. So I'm super excited to talk to you guys today. If you don't know, this podcast comes out once a week. We have great interviews. So hit the like, subscribe button and give us feedback on this is helping you in your medical practice. So before we begin, Dr. Durag, let's talk a little bit about your experience of, going through medical school. And now I think we talked before, you only have a few months before you're out. Talk to me a little bit about as you're transitioning into the space of, practicing on your own. What are you thinking about when it comes to emergency medicine, right? We found that 60% of ER visits are preventable, especially when you have better access to primary care. What are your thoughts about that as a coming a doctor that's about to emerge in the field? What are your thoughts around that?
I would say, emergency medicine is amongst the most critical for a lot of patients who come through into the hospital or end up, being admitted. Their first interaction is with an ER doctor, ER nurse, anybody on the ER staff. Unfortunately, I do feel like a lot of these cases are preventable. And a lot of that kind of boils down to, the conflict theory or like some barriers, some social barriers, social determinants, things like that may render patients kind of hopeless in terms of not having access to care, not having the wherewithal, the communication, the transportation to get to their doctor visits, to be regularly seen by a PCP or any type of provider, to then help them with their chronic conditions so that they don't end up in an acute situation to where they have to visit the emergency room. And so just in my experience now, as a student and also gaining more autonomy and taking care of my patients and, acting as the provider, I see how important it is to make sure that I'm relaying as much information or understanding the intensity and the importance of, the social work aspect of healthcare that goes into why they ended up in the ER in the first place.
Yeah, I love that. I mean, and, we can transition directly into this, like education of patients around the healthcare journey, the understanding of that. Kind of walk me through, like, when you first started talking to patients, how did that evolve from what you're doing now on social media with the songs and educating patients? Kind of walk me through that journey and what made you say, hey, there's a better way of doing this to kind of educate patients around their health journeys.
Yeah, for sure. When I first started, I mean, as any other person, when they first start out, it was absolutely terrible. Fumbling on my words, trying to figure out what I needed to say, kind of acting as who I like thought I needed to be when communicating with patients. And there was this one patient in particular when I was working at the VA. There was a barrier to communication with the team, and I had just began the service and I rotated on, and I'm trying to talk to this man, and he's yelling at everybody and screaming, just very uncomfortable. And I went home after that day and was like, you know what, like let me try something different. So the next day I didn't go in with my white coat. I still had my scrubs and my stethoscope, but kind of just wanted to talk to him, like I actually meet him, like, hey, what's going on? I'm from Newport News, Virginia. He ended up being from Norfolk, so you got the 7 cities in common, and we just ended up talking. And he ended up being a really great guy, but he was frustrated because he wasn't they were updating him on his plan, but all the social factors that was going into, like, how can his wife get there? How can his kids see him? Things like that, that wasn't necessarily attended to. And that just allowed me to realize that when dealing with the patient, as much as we have so much on our plate as providers, we need to be focused on every single aspect of care, because there might be treatment plans that you may recommend, but their local pharmacy may not offer that, or they might not have the facilities to make certain things happen. And so I just began to really try to tailor and start from where I'm meeting the patient and say, this is the level of understanding that you have. What is the most optimal outcome for you? Not just what would make me the most happy in terms of your treatment plan, but what is the most optimal outcome from you? And then we work towards that goal and we align together. And so the patient is also practically leading the treatment team in terms of us trying to meet their desires, and just making sure that, it's all like in accordance to, patient safety. And so over time, just kind of really starting fresh with every patient that I see and say, where can I get you to understand what needs to be understood? And then also, where can you get me to understand what needs to be understood so we both can move forward?
Hmm. I think that's so key. We talked about this in previous podcasts of other providers. We talk about the 3T framework we thought about where it comes to like that patient and doctor interaction. Testimony, right? The first T. Basically, you shared, where you were from, give me your testimony. So he said, "Oh, we're on level fields, right? I can have a conversation with you because you're kind of from where I'm from." And then being transparent about like, "Hey, we don't know this here. How can we help you?" And being open to that. And I think when patients kind of see that testimony and that transparency, then the trust opens up, the last T, and that helps you kind of build that awareness and helping the patient through their struggles. So I love that you kind of went through that journey as well, independently, and kind of came to that. Look, we didn't talk about this before the pod, but is there anything you can spit a little bit to say, hey, this is what you kind of say from an education standpoint? You could just be two bar. It doesn't have to be a lot, but just anything that you would say to a patient that, like for instance, he was struggling with, the, I guess the social terms of health aspect of his care.
So, like right now, I'm trying to kind of get a little bit more into like the most common comorbidities and kind of work towards patient care. So, like, kind of explaining, like, say for instance, diabetes is um, like carbs turn into glucose, and if not, then it's turn to glycogen. Pancreas sense when we eat, and the beta cells release insulin. Uh, I'm forgetting. Um, but yeah, something along those lines, and it's
No
like
worries.
diabetes
Yeah,
type
yeah.
2
We
is.
put you on the spot. We didn't talk about it, but I
I'll
like
send you
that.
a track later. But it's basically along the lines of like kind of trying to meet them where they are, and then zoom out as far as possible to the big picture, and then intentionally leave gaps in the knowledge so that they can have the autonomy and incentive to go and like figure out what knowledge is missing because they've already been intrigued by like some of the raps that I've done so far. But like previously, I've done a lot of things more so on like a cellular, a molecular level. But now I'm kind of trying to get towards, or like here's one. It's like if you over 50, go and get your colonoscopy. Females over 40 got to schedule that mammography. 50, and you got a 20-pack year history equipped with M15, then you need a low dose chest CT. So like kind of trying to give them like the screening and preventative measures so that they can get ahead of some of the things. So that's also some stuff that I'm kind of working on too.
I love it. I love it. I mean, how long have you been doing this for on the socials?
Uh, that's kind of a hard question. Like I started like my freshman year of college, and I wrote like songs on photosynthesis and some of like the kind of like molecular information that we were learning, like chemistry and biochemistry. The songs were actually terrible. I'm glad that like nobody really seen them, because there was stuff that I was rapping that was wrong, or at least I was mixing up like certain processes. So I'm glad that like I took some time to sit in the incubator. So I guess technically for like the last 8 or 9 years, but it was up until recently when, after like my third year and seeing a bunch of patients, like I just kind of got this feeling in my heart, and I was just like, there's something that I should be doing a little bit more. And like my wife can tell you, like I'll be in the living room like pacing back and forth, and I'm just like, I just need to do something. I don't know what it is. And she's like, you just follow your heart. And like the first few videos didn't really do much, but she was like, it's not the purpose of like, getting big on social media or a lot of people seeing, and it's just a matter of like a few people and it reaching whoever. And you can say that you made that much of a difference. And that's what I led with. And now, by the grace of God, like, I'm expanding and like learning how to scale my social media. But at the end of the day, I think that I've actually been able to actualize who like my target audience is. And I always say that when it comes to clinical raps, I'm making a rap to be understood by a young kid who's being raised by their grandparent,
Hmm.
so that they can have the wherewithal to notice, like, what things can they communicate to the grandparents that they should know? What things can they be talking to like aunts, uncles, parents, and things like that? But also, like, how can you start that conversation so it's two different generations communicating about health? And so they can be on the lookout on certain things. Because even my family personally, like my father wasn't as close with his father. And there was health conditions that, we didn't necessarily know about, it. We weren't necessarily as clear on. And so now my father is, being proactive and getting checked up, getting the screenings. And I would like that to happen for future generations of kids who know what might come down the drain, should they, not necessarily know what they're at risk for.
No, I agree. I mean, my dad recently suffered from congestive heart failure, and just kind of help him go through that process and transition. It was difficult, quite frankly, and being transparent here, but he was able to kind of, shepherd through that with the help of, family members and myself, just talking to him. And then, and I'm getting in my age, I'm in my late 40s, and my wife is a nurse, is telling me you need to get a colonoscopy, right? Like, you take these reps. And so,
I was taking
now I'm not going to forget that now. Quick question. Drake or Kendrick?
Kendrick.
Yeah.
Yeah, it's Kendrick, but like I don't not like Drake. I don't think it was like a rap beef for like who was the better rapper, and I think that like people mix that up in terms of the message. Like personally, like when I was like I'm like I told you before, and I'm from Newport News, Virginia, and then I came to VCU when there's other people who are from like more affluent areas, but I seen like some of those kids kind of like acting hard or like acting like they was from the streets or like trying to pose and everything like that, and like the feeling that invoked in me of like this is weird because anybody who is in a better position wouldn't necessarily be promoting that. They would be trying to advocate for getting away from it if they actually knew what that lifestyle was like. And so I think that was the essence of the rap beef, was that like you make good pop music and good dancing music, but like you're benefiting and like profiting off of like people's worst experiences in life when you haven't lived that lifestyle. And that's why I say like I side with Kendrick.
And
And
guess what? And he did it in a bop.
yeah, exactly. No, that was
He
great.
talked about him in a bop. So they were playing at the Super Bowl. So yeah,
Crazy.
it's yeah, complete. I don't know if you play Mortal Kombat, but finish him. It's just total annihilation.
It was bad.
But anyway, we digress. When we kind of think about this, the journey that you kind of think about from a healthcare standpoint, what are your thoughts about like technology? You're about to be in the field. You're still connected to social media. Obviously, you're looking at technology, the advent of AI. We do remote blood pressure monitoring for patients that suffer from hypertension. We help with diabetes as well for our devices and technology. How do you see technology like remote patient monitoring and artificial intelligence shaping how you're going to care for patients in the future? Have you thought about that?
Yeah, for sure. I like I'm applying in anesthesiology, and so that's amongst one of the top fields that are figuring out ways to really utilize AI for patient care, but also in a way to like have it safe, just as how they're doing in the ER with a lot of the new technologies. I think AI is definitely the future. Ever since the information age has started, there's been rapid and exponential differences in how we live life, and then also that's trickled into us practicing medicine. And there's certain things that are coming out now where I'm like, goodness gracious, like I don't even understand it, and like it'll take forever to understand, but it's like it's changing so fast. And even with the remote monitoring, looking at patients' heart monitors, blood pressure, you know, different pieces of information that we have. Like that's part of the problem where like you can get well before even having to show up to the ER because like there's somebody with like that's more knowledgeable on this one specific topic that is looking and monitoring you and taking care of you and like, you know, giving prophylactic agents or making recommendations, or if they need to treat or what do they need to treat. And like, you know, certain things that might become acute, they may not necessarily even get to that stage because somebody's on the lookout, somebody's looking at your numbers, somebody's like monitoring you. And most importantly, the people who are monitoring you aren't just people who are like, you know, the health influencers that we talked about on TikTok, or who's like, you know, take this gummy or take this thing, like it can solve your problems. It's like, no, these are people who are going to put in practical applications and then help you get to where you need to get with the help of AI. So I definitely don't think that it's like, you know, AI only providers hand off, but I do think it's a great adjunct to a human provider to then, you know, make those decisions and help our patients.
Absolutely. I mean, radiology, obviously, there's a ton of AI kind of
Yeah.
finding things within the chart that they can kind of find in imaging to kind of help with patients. Charting, you know, basically AI charting. So basically, as you're talking to the patient, instead of having medical assistant there, kind of just typing notes, or you're in front of the computer and not looking at the patient, you can have the
Yeah.
AI kind of capture that and do all the charting you need, because obviously healthcare is now about charting properly from an ER standpoint, for a medical record standpoint, but from a data standpoint. And so having an AI to kind of track that, we're seeing the proliferation of those kind of tools, right? You know, to kind of help with not so much diagnosis, but analysis, and also helping with capturing information. But to your point, I would not trust AI as a technologist uh, to diagnose me for cancer or something to that effect, right? Because there's a thing
For
called
sure.
hallucination where it's making up stuff based on what is really what it is a predictive engine. It's just trying to determine what's likely to happen and say. But
Hmm.
it's not based on any deep analysis around that, right? And so I
Yeah.
think that's the key. But you know, it's wonderful tools. I mean, if you're looking for it to help with, they're called AI agents that are coming out, where they're going to help kind of do some of your charting or some administrative paperwork using your computer screen. You can do things on that level. And billing, you know, medical billing is going to be a big piece of that, prior authorizations. So yeah, so you know, AI, and then obviously getting more data from the patient is always a good thing, because you can see trending information, especially if they have hypertension, uncontrollable hypertension. We're seeing the more and more doctors enjoy that, especially specialties like cardiology, nephrology, who really, you know, need to understand how the hypertension is changing their factors around chronic kidney disease and cardiac issues. So yeah, so those are some of the technologies that we're seeing kind of taking the forefront. So we kind of think about, you know, your journey. You know, you kind of hinted at this, like getting on social media and talking about, you know, there was something deeper in that. But if a doctor is out here saying, you know, I don't want people just to listen to these influencers who have no bearing on what they're saying, but people who I have something to give back. What are some of the things if your colleagues were reaching out to you, what are some of the things you would tell them how to get started on social media and put yourself out there, which is something I know a lot of doctors struggle with?
I would definitely say just do it. Like it sounds cliche, but like there is a lot of like the whole analysis paralysis, and even that's something I struggle with too. Like, you know, you might see the final product, but sometimes I'm just like, all right, cool. I'm just like drop it in, and sometimes it ends up really doing really good. Sometimes I don't have videos that do good, and I thought that would have really did good. It hurt my heart a little bit. I ain't gonna lie, but at the same time, it's like, and every time you're doing something, you're learning more and you're getting better. So like the stuff that you look back on is going to be like, why did I even do that? However, if I never did those things, I would never be where I am with social media today. Second thing is, well, I guess it's like to echo that or like to build upon that. When you like post videos, like when you make content or like when you're really trying to get into your groove with like social media, understand that like whatever you do, let it be fun so that by the time you post it, they have already seen the end product so that you can fully detach yourself from whatever content you created. So for example, like I really enjoy just driving down the road, listening to beats and like thinking of like cool things and like learning about like the electronic transport chain or something like that. And then I really like writing the raps and I really like, you know, listening to it. So by the time I already post the video, it's not really much that if somebody says something really bad about the video or like the song, like I'm detached from it. I already had the fun. You're just seeing something that I'm sharing for information, but I like the enjoyment that I had from creating that I've already gotten. And then also, you know, the other side to the coin to that though is that with social media, you can't really get like big headed, or when you're getting a lot of compliments and like, of course it feels good, but like just as much as that bad comment feels, if you're up here and you are soaking in all the good comments, you're going to do the same thing with the bad comments. So it's best to kind of, try to stay level headed. And then lastly, I would say as physicians, like it's a unique population of individuals where like, we are working in the hospital so much that you don't have as much interaction, and social media has provided the opportunity for you to like give information and provide information online that many people like actually need. Like I know a few people on social media who just honestly like doctors who just go around and like find like the videos of people like saying some off the wall stuff that doesn't have much medical like background or insight, and then they kind of dispel and disprove that to provide patients with the information that they need, so on and so forth. So overall, like as a provider, I'm not saying it's easier to like going down the social media route. But as long as you stay true to yourself and you just kind of do what you've been doing, like do your profession, but like obviously like with HIPAA and everything, like just make sure you're not violating any rules. As long as you get started, somebody's going to figure it out soon, and then that one person is going to share it, and then like multiple people are going to share it, and by the time you blow up, your content is going to be so much more better than what you started with because you've had time to grow as well.
Yeah, I love that. I mean, we talked to dozens of providers across the country. Very similar stories, right? I think there was something in their heart that they felt like they had to get out. Dr. Isang, he's a cardiologist, and one of the things he was talking about was he felt like he kept answering the same questions over and over again. And he said, just put it on social media, right? And helping other people, right? Just to have a checklist on things to check. Or we had Dr. Refi, who was a pulmonologist. So during COVID, he put out something that went viral on how to breathe if you're suffering from, a low breath. And so it was things like that. Stories time and time again is just like you said, if you focus on the intention behind why you're putting the video, right, to help people, then, you detach yourself from the outcome a little bit more. And then the other thing you said was the process. You enjoy the process, the inputs, like listen to a beat or learning a new way of thinking about, medical procedures or process. And I think, more people just focus on the process and the inputs and don't worry about the outcomes. And, you're not really attuned to that. And likewise, same with me with social media. I was never on social media, 2 years ago, but very rarely I look at my stuff and I just put it out there, right? People like it. They think it's insightful. Great. Bad comments here and there, it's no big deal, right? But it's just about what's my intention behind it, to your point. And I think if more doctors were more understood that and say, hey, look, you have something valuable. I mean, what you're saying is evidence based, is not somebody's opinion, right? That can get someone hurt. And, we're going to see that proliferate, unfortunately, with the rise of deep fakes and AI and fake information out there. So we need more experts like you out there going to rooftops, telling people the truth and what's really how to do, you know, evidence-based medicine and what's going to really help you to be healthy. And I think you encourage, other folks to kind of follow you as well in the work that you're doing, your journey. Wow, this has been insightful. I think, people can learn how to get started in their own social media journey if you're a provider, how you think about technology, and also, just putting yourself out there, be authentically yourself. I mean, Dr. Durag is definitely specific to you and what your thought process is. And so just also your journey, because I think you even use rap to help you understand the concepts in medical school. So this
Yeah,
is,
definitely helps.
and people see that, right? I think you hit the nail on the head. I think they see that passion. And so that's what draws people to you, right? And so I think that's so powerful. So, Dr. Everett, this is, man, I really enjoyed, talking to you today. I mean, talk to everyone, what's next for you. I know you're trying to get through medical school first, but yeah, anywhere they can find you at social media. Are you doing anything, a meetup, to do some raps around the table, do some beats and raps at the school table? Where are you going to be? Where can we find you?
Yeah, for sure. So my Instagram, well, all of my handles, Instagram, TikTok, Twitter, YouTube, etc., is Terry underscore the twin. What's coming up next is my med school match day is on the 21st of this month. So y'all wish me luck. But also on the same day, I'm releasing my first medical album. And it'll be around anywhere between 15 and 18 songs, conjunction of the content that I already posted and also some new tracks. And then all of them will have the lyrics, so you can follow along. It's kind of like a study guide to learn some new things. Yeah, that's pretty much the big things right now. Graduation in May, and really just trying to focus on staying on the straight path and kind of getting ready for residency. but then also try to make sure how I can maintain and learn some new skills so that when I do get in residency, I can still somewhat juggle and balance, my social media content without it taking too much extra time.
Awesome, awesome. Well, this is very insightful information. I love what you're doing out there. Everyone, please take what Dr. Everett is saying to heart, use it in your everyday practice, but more importantly, put yourself out there and be authentically yourself. Let's think about this as healthcare is changing, rapidly evolving. This new normal of healthcare, you can be a success. Thank you, Dr. Terry. Have a great one.
So thank you for having me. Take care.
Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left and you'll get more content to understand how to best grow your practice.